Canadians are facing an opioid crisis. We've been covering this for several years now. Dr. Masotti, Medical Officer of Health from the Windsor Essex County Health Unit, joining me now. What is your team doing about this crisis? It's tragic to hear that this is still ongoing.
Opioid crisis has affected us for decades, as you said, Stefanie, and there's a tragic number behind that. Not everybody affected in the same way. Some people are affected more. Whomever is higher in the ladder of social and economic privilege might affect it less. But we are approaching this from different angles. One is harm reduction. Our goal is to save lives. This is a priority for us, and harm reduction also prevent extension and transmission of infectious disease as a result of unsafe drug use, and provide that opportunity for people to get into treatment when the time comes for them.
We've been talking a lot about opioid, but there's other substances that people are abusing that we need to pay attention to.
That's right. I'm deeply concerned about illegal but harmful substances that people can have access: alcohol, cannabis, nicotine, particularly on children and young adult youth. That's a very concerning issue, and we are tracking that. We are working collaboratively with school boards, with other community partners to make sure that people, children, their families are educated about these drugs, and they can have an honest conversation with their children.
Okay, and there are actually some concrete things that you guys are providing in the school board, right?
Yes, we're working with them very closely in terms of education, in terms of that conversation that can happen at the school and prevent that first exposure to substances early on in their life, which can prevent children from continuous access to those drugs.
Okay, Dr. Masotti, thank you for joining us once again.
Thank you.